Hello and welcome to Empathy HIT. Your host, Dr. Sandy Whitehouse, is the CEO and CMO of Ticket Health, an award-winning global provider of digital solutions for capturing data directly from and in communicating with vulnerable people within diverse populations. On this podcast, Dr. Whitehouse chats with providers, partners, and industry leaders on topics ranging from digital empathy to social determinants of health, to rethinking how we collect information critical to improving health outcomes.
Welcome to Empathy HIT. I'm honoured today to be joined by Dr. Elizabeth Borycki, a professor in the School of Health Information Science at the University of Victoria. Elizabeth is the Director of the Global Laboratory for Digital Health Innovation in the School of Health and Information Science. Elizabeth received her PhD from the Department of Health Policy, Management and Evaluation at the University of Toronto, a master's degree from the University of Manitoba in Geriatrics and Community Health Nursing, and an honours Bachelor of Science in Nursing from Lakehead University. She is certainly well qualified. Elizabeth joined the University of Victoria over 10 years ago. Prior to joining the university, she spent over 15 years working in healthcare in various roles in chronic disease management, geriatrics, case management, clinical informatics, as well as health IT design and implementation management. She has published over 150 articles, book chapters, and books in health and health informatics. So to start, health informatics is a relatively new interdisciplinary field in the healthcare industry, and it uses information technology to improve outcomes. Its influence over healthcare's digital transformation has grown significantly over the past decade, but in a matter of months, the pandemic broke down long-standing barriers and accelerated digital health at a pace few could have imagined. What changes have you seen over the past year with respect to health informatics?
Well, it's kind of interesting. We've been sort of digitizing and modernizing our healthcare system for the past, I would say, 10 to 15 years. With the introduction of electronic medical records in physician offices, the modernization of healthcare facilities with electronic patient records, we've seen a huge growth in the number of patients who are using mobile health apps for wellness as well as for disease management. But what's kind of interesting and what has happened in the last year is we've really seen the silos broken down between organizations. So, and when I mean silos, I mean virtual care has actually helped to bring health professionals and patients closer together. Before, when you had to travel in order to see your physician or to go to a healthcare facility to receive care or be able to speak to someone from the healthcare team, now we can do a lot of that virtually. And of course, that makes things change quite a bit in terms of how we interact and what kinds of things we need to do in order to help the health professional to be able to understand what the patient's condition is, as well as for the patient to be able to effectively communicate with the health professional about what their particular issues are from a health perspective.
Yeah. So it really is interesting that healthcare is moving towards a consumer-centered model. How do you see health informatics influencing the role of the patient and how they engage with providers?
Well, there's a number of things that we've been doing over the last year. So some of it has involved actually developing different models of virtual care. So what kinds of technologies are used when and in what circumstances and contexts. So what works best, for example, in having a conversation about mental health issues, what works best in terms of providing information around a mold that might be a cancer. So it's identifying the technologies that work best that are available to patients and their clinicians and helping them to communicate in a way that's effective and empathetic.
Yeah, very important. So healthcare organisations and clinicians need access to critical information to care for patients. You must have noticed the increase in self-reported data options and the adaptation of technology with COVID. What are some of the benefits and challenges for patients in accepting the increasing role of technology in this communication?
Well, it's kind of interesting. We all use technology and we have been using different forms of tech over the last few years. Most of the time, we've been using it for activities that support something that we do. So, for example, we might use a Zoom call to speak with colleagues, or we might use the technology to self-monitor and then report some of that data to other members of the healthcare team. So, what we've seen is more of a shift towards integrating many of these things. So, for example, we have the ability to provide that patient and that physician the ability to share information, let's say from an electronic record or in and around a mobile app. We also have the ability to provide physicians, historically you might be sitting in a waiting room, you might fill out a questionnaire for the physician to look at. Now we have the ability to do that online in a virtual waiting room. So what we have to start looking at is what kinds of things do patients want to see and feel most comfortable with in terms of providing information and feeling comfortable about providing specifically health information, because it is a different context. You're not sitting distinctly in a physician's office with the door closed. It's actually a virtual environment that's private and secure, and it allows for transfer of information both back and forth from the physician as well as from the patient.
Yeah. As a researcher, you really have a lot of access to evaluate these sorts of changes. And what I'm interested in is, what are the characteristics of technology that make it successful? How do you measure that? And can you give some examples of where the technology has really made a difference?
Well, it's interesting that you're mentioning this. So we as a group, so health informatics professionals and technology professionals, have created technologies that we envisioned would support care. But with this transition to an environment where there's less of an ability for face-to-face communication in a physical room, there has to be a need to address what kinds of things need to be present in order for that technology to support the same quality of the interaction. So now we have to start looking at things like, for example, is the technology easy to use? Does it provide the right information? Does it provide information in a way that's easily digestible? And in addition to that, is the technology supportive of engagement? So does it lead someone to feel confident in their ability to disclose information around their health and be able to interact with the physician? And these are the kinds of things that need to be looked at. What we're starting to see with COVID is this emergence and pressure being put on the system to increasingly create technologies that are supportive like this, and supportive in different contexts and environments. In addition to COVID, we're starting to see more and more environmental disasters, and we're also seeing communities not being able to travel. So there is a need to create these types of technologies that recognize that there's a desire to engage on the part of the health professional and the patient, and how do we make that relationship and that engagement more fulsome and interactive. And again, that improves the quality of care. So from a measures perspective, what has started to emerge is we're starting to see increasingly different types of tools being developed to create technologies that support that type of relationship. In parallel to that, there's some research that's going on that is starting to collect data around engagement scales. Is the user engaged with the technology when they're using it? So they're collecting information about the technology itself and how well it supports the interaction. And it stands to bear that if the technology does a good job of that, the health professional will be happy, the patient and their family will be happy, and they'll have learned more from the experience. They would have processed it better, and then they'll be able to take that knowledge that they've received and that information they've received and action it as far as their health is concerned. So it was kind of an interesting, as we've introduced this new thing, which is the tech, and it's becoming more and more pervasive, you have to recognize that it actually is sort of like a filter, and the quality of that filter in terms of its design, how it supports work, how it supports interactions, influences the outcome. And the outcome is whether or not the patient has an improvement in their health status. So it's increasingly much more important. And I think in the next few years, this will be a very significant area push, because COVID is going through a period where it's actually, there's more variants, and there's going to be a lot more pressure on the system to continue to minimize the number of opportunities for this virus to replicate until we have a fully vaccinated population. So in order to satisfy the public health piece, as well as the individual health piece, we need to have technologies that support that.
Yeah. So thinking about what you're talking about with the triple aim concept and then patients as partners in care, there's been a huge growth of that interest in that and bringing patients along in the last decade. And I think what you're saying is that the technology was not necessarily part of that patients as partners in care. And now the technology, because of COVID and because of our changes in our system, is really moving forward front and centre. And it has to make some of those accommodations to bring the patient along and have that more consumer-facing approach. So that brings me to digital empathy, which uses a personalised approach to collecting information to improve outcomes. It's a new concept that is just sort of starting to show itself. Rather than taking a one-size-fits-all approach, it transforms the data collection process, prioritising the attributes of what makes us individuals to let participants know that we truly care and respect them as an individual. Where do you see the role of digital empathy and the impact it can have in delivering care?
I actually see it as having a huge role as an idea from a healthcare system perspective and from a quality improvement perspective that we go through these phases. So we started off with physicians, go out into the community, you'd have your patients, you take care of them, and then that process would happen. Then we moved into this model where we were trying to create some standards. So we created some standards. We have brought in a lot around evidence-based medicine. And the idea was that we could address 80% of the problems using these particular approaches that we know are based in science, and the 20% we still have to learn more about, and we would add to that. Then we got to a point where we started to produce and provide healthcare at a mass level. So you had these large hospitals that were created that had purposes around providing surgeries, providing therapies, and all of that took place. In each time point, we've actually improved the way that we provided care, as well as we've been able to reduce some of the costs associated with it. So now we've got these digital technologies that allow us to provide more care to larger populations, because now we can actually reach out to people who can't get access to the healthcare system in a traditional manner. So this personalization with digital empathy is important, because not only do we have the technology that reaches, we also need to provide that same level of tailoring that takes place at an individual level, yet it can reach out to the large groups of people. So in order to do that, technology actually gives us more of an opportunity to do that than even a hospital, because a hospital is constructed in a particular way as a building. Whereas from a digital perspective, we have the ability to construct things in such a way that they actually match what the individual needs. In a hospital, if someone's got a disability, you might require a ramp. In this case, you'd have to create a user interface and workflows as well as ways of accessing the system. But the ramp can be customized to the point where it fits perfectly for that particular issue. Whereas in the traditional hospital environment, sometimes those wheelchair ramps, in some cases, they may not be placed in the right spot. It might be more difficult to get to it. So it's very, very different. The other piece, too, that I wanted to add on to this is that in the process of working through these issues in a digital environment, we can learn from this, and then we can actually continue to apply it and learn from users how to customize, or in essence, deal with the things that they want to have done, and as a result, meet their personal, physical, and mental health needs.
It's really interesting to think about how the technology can give us so much flexibility and scope, and actually on a mass level provide that individual care that people so need. What are some of the other things you've seen along your professional journey that were just so inspiring to you? And what were some of those pit stops that really kept you fired up?
I think what I'm very conscious of is technology affords us the ability to access information. It affords us the ability to learn independently and use technologies that support your individual learning in different ways. And it also supports your ability to do that in differing settings. What makes it important is that it's in real time when it matters. So when you have real questions and you need to have answers, you can get them. And in addition to that, you can actually have a better conversation with your healthcare professional, and you can go through material together. And again, if something is meaningful, it's accessible at the right moment in time, and you have that person who is helping you to regain health, then it sticks better. And it can follow you through the whole process afterwards, right? And you'll look for different things at different points in time in your illness trajectory. Technology, I think, has opened up a lot in terms of knowledge, information, and it actually helps you to become more empowered in terms of your healthcare and in terms of managing your own healthcare, and then even asking your health professional about the nuances of things. So the things that aren't necessarily published, but the health professional has knowledge and insights into because of their training and their practice. And that's the part that helps you to also have a good experience and one that's tailored to you.
Yeah, we still need our healthcare professionals, but this can add a whole other level of engagement. Well, it's been fascinating. I've got many more questions and things that I'd like to learn, and you, particularly from your vast experience and research and thought leadership. It's been a pleasure speaking with you today. Thanks a lot, Elizabeth.
Thank you for joining us today. You can follow the conversation on Empathy HIT on Healthcare Now Radio or at tickethealth.com or at #DigitalEmpathy. And be sure to follow Dr. Whitehouse on Twitter at Sandy Whitehouse.